Eye problems. The best treatment options. The eyes are complex organs, with many parts that must work together to produce clear vision. Here is a basic overview of eye anatomy. Acanthamoeba keratitis. A rare but serious eye infection associated with poor contact lens hygiene and other factors. Amblyopia, lazy eye. Amblyopia is a vision development problem in infants and young children that can lead to permanent vision loss. Learn the symptoms, causes and treatments. Astigmatism. Usually caused by an irregular cornea, astigmatism causes blur at all distances. Also see the eye doctor Q&A on astigmatism. Bell's palsy. This condition causes sudden paralysis of one side of the face. Because it affects blinking, it can cause severe dry eye. Blepharitis. Inflammation of the eyelids associated with chronic eye irritation, watery eyes, foreign body sensation, sensitivity to light and crusty debris at the base of the eyelashes. Blurry vision. Blurry vision has many causes, from fatigue and eye strain to serious eye diseases such as glaucoma. Burning eyes. How to get relief from burning, stinging eyes. Cataracts. The risk of cataracts increases with age. Cornea transplant. Eye injuries and diseases like keratoconus may require a cornea transplant, using healthy tissue from an eye donor. Corneal ulcer. Treatment may help prevent scarring on your eye. Dry eye syndrome. Why eyes get dry. Also read about dry eye treatments and relief, such as eye drops, tear duct, punctal plugs and nutritional supplements for more eye moisture. Symptoms and complications. Obviously, with so many possible causes, the symptoms of eye infection can vary a lot. What a person feels generally depends more on where the infection is rather than on what's causing it. Common symptoms of conjunctivitis include redness and itching. Discharge. Viral conjunctivitis, discharge is usually watery or mucus-like. Bacterial conjunctivitis, discharge is thick and can be white, yellow, or green. Feels like there is sand in the eye. Crusting over of the eyelid. Common symptoms of keratitis and other frontal eye infections are pain, itching, or sensation of a foreign body in the eye. Photosensitivity, aversion to bright light. Redness or small red lines in the white of the eye. Discharge of yellow pus that may be crusty on waking up, a possible sign of bacterial infection. Tears. Swollen eyelids. Constant involuntary blinking, blepharospasm. Diagnosis. Ophthalmologists and optometrists are trained to recognize various eye infections by the appearance of the surface of the eye and the retina, the progress of the disease, whether it's in one eye or both, and your medical history. There's a wide range of lighted devices for looking at the cornea and retina. If there's pus or discharge from the eye, it can be cultured to identify the organism. Quite possibly, you'll also be tested for common diseases like chlamydia, gonorrhea, and herpes simplex. You should see your doctor or eye care professional if you have eye pain, altered vision, severe redness of the eye, or continuous discharge from the eye. Recurring eye problems. Eye problems along with a chronic condition such as diabetes. Changes in pupil size. Recent injury to the eye. Treatment and prevention. Viral conjunctivitis usually improves in a few days without treatment. Broad-spectrum antibiotics will deal with most cases of bacterial conjunctivitis or keratitis, while particular antibiotics are used to treat gonorrhea and chlamydia. Most fungal and parasitic infections are also treatable by various medications. The exception is histoplasma, which can't even be detected in the retina. You can cut your risk of eye infection by observing safe sexual practices. That means using condoms, and, ideally, limiting your number of sexual partners. The same is true of cold sores, shingles, chickenpox, measles, mumps, flu, and the common cold. All of these diseases produce spots, rashes, or mucus that carry the organism. Glasses. Vision problems such as short or long-sightedness can be corrected using glasses. These usually need to be worn constantly and are checked regularly. Using a patch. Using a patch is known as occlusion. It involves placing a patch with a sticky rim over the good eye so that the lazy eye is forced to work. It can be very effective in improving the sight in the lazy eye. Eye drops. Side effects that can occur after using eye drops include eye irritation, flushing, reddening of the skin, headaches. Wash your eyes. Ayurvedic practitioners say that one must avoid splashing water directly into the eyes, instead you can use a Tridoshic eye wash. Diet for healthy, stress-free eyes. Dry fruits and nuts, almonds, raisins and figs are elixirs for the eyes. To help them cope with the demands of your day-to-day activities with this home remedy. Carrot and amla. Another good home remedy for eye-related disorders is to have 1 cup of carrot and amla juice, on an empty stomach in the morning. Carrot and amla have a lot of vitamin A and are storehouses of antioxidants that help beat the ill effects of oxidative stress in the body. Vitamin A-rich foods. Include foods rich in vitamin A into your daily diet. Foods like carrots, green leafy vegetables, amla, oranges, anjeer or fig and almonds are packed with this essential vitamin.